So welcome everyone. Welcome to today's webinar. And what we hope is going to be a very informative session based around the topic of driving improvement through effective document management. So today we're going to be talking with Clare Harney, who's a leading figure in digital health transformation, widely recognised for her expertise in digital health strategy, compliance and go-to-market services, specialising in areas such as healthcare optimisation, intelligence automation and regulatory compliance. She has a 4th degree black belt in Taekwondo and is a world silver medalist. So everyone better pay attention to Clare today, otherwise we'll send her to your house. And in conversation with Clare today is Leonora O'Brien, an Irish pharmacist, entrepreneur and advocate for patient safety, with over 25 years' experience in pharmacy practice, policy development and regulatory affairs. Leonora's made significant contributions to healthcare innovation and technology, leveraging her pharmacy expertise to create impactful solutions that enhance patient safety. Fortunately, she also works as Chief Growth Officer for MEG. Just a little bit of housekeeping. So please feel free to pop any comments into the live or questions into the Q&A. So there'll be time at the end that we're going to go through the questions and respond to those. And also, if there's any elements of the software that you feel might be of benefit to your organisation, we'd be absolutely happy to arrange a one-on-one call to go through that with you after this session. And there'll be an email that you can use at the end to contact us, or actually I'll just pop my own email address in the chat line as well. So Leonora's going to start just with an overview about MEG. Then we're going to talk to Clare. Leonora and Clare are just going to have a conversation around that. Then we're going to have a deep dive into the system, have a look, and then there'll be Q&A at the end there. So I'll just hand over to Leonora.
So thanks a million to everybody for joining us today. So first of all, before we jump into our interview with Clare, and thanks Clare for coming along today, I just want to tell you briefly about MEG and what we do at MEG. So we simplify healthcare quality and patient safety management with intelligent software. So we help to keep your patients safe, and also we help you to comply with all your regulatory requirements such as JCI, HICWA, etc. So we work with healthcare organisations, large and small, across over 22 countries. And we have all these modules that you see here on the screen. We have a full quality management system, we have audit management, patient experience, document management we're focusing on today, staff training and credentialing, incident and risk management, accreditation, etc. So we are constantly evolving the solution as well. So we have the likes of clinical pharmacy module, which we've done a recent webinar on. So the system is modular. You can choose to use any of these modules on their own, but increasingly people are electing to use the full quality management because it really comes into its own when you're using the full system. It reduces cost because you don't have to invest in disparate systems, but it also gives you a 360 view of all your quality KPIs in one dashboard. And it also promotes that connectivity across your teams within your organization. So why do people select MEG to work with? Because it's very intuitive, it's mobile friendly, and we've got an excellent track record of delivering customer support for our clients. We're specialists in healthcare quality, so we're not sector agnostic like some solutions. And we really invest in domain expertise, so we get those really deep insights that'll add value to your organization. It's a highly interoperable solution as well. So we have HL7, FHIR integrations with the EPRs, and also we have APIs, and we have recently, for example, integrated with IPIMS here in Ireland, so the patient administration system. So we'll just move on to the next slide there, Ange. Thank you. So just today we're focusing on the document management module, and document management is the backbone of your quality management system. And yet many people who may have quality modules like your audit or your risk management, etc., they may use a different system, like a generic system for like SharePoint or QPulse for their document management, but it's really beneficial if you use the same solution for all your quality improvement needs. It's more efficient for a start, but also you can really importantly, you can dynamically link all your policies, your procedures, and your proof of compliance to standards set by your accrediting body or your regulatory body. It's also much easier if you have that 360 view of your quality performance all in one dashboard, and that's what you get with the MEG solution. So Dan will give us a demo at the end and we'll share these slides, but just to mention a couple of key features that you might not get with the more generic solutions. An important one is attestation, and that's being able to demonstrate that users have understood the contents of the document that you're sharing with them. So not only read the document, but as accountable professionals, we need to be able to make sure that they've read and understood the document. So you get that with MEG. Also, the drafting and the approval and the review of the documents is very, very simple. You've online collaboration with your colleagues, automated alerts and reminders and update scheduling. The system helps you manage by exception. So if you have 200 colleagues, for example, that you need to train up on a process, then if two people haven't read and understood the document, well, the system can be automated to follow up with them, and it sends you a report when everybody is compliant. So from a governance perspective, it's imperative, and it really gives you peace of mind. So then you can focus your time on your patients or other strategic initiatives. So ultimately, with the MEG solution, you can ensure that you've got the right version of your document in the hands of the right people at the right time, and at the point of care. And this is a must for your audits and governance. So if you're using another solution like SharePoint, for example, and we move on to the next slide there, Ange, thank you. You may think it's quite difficult to move across into MEG. It's a thing called migration anxiety when you've invested a lot of time putting all your documents in and tagging your documents in the system. But moving away from that can feel pretty overwhelming. But at MEG, we've created a simplified migration approach that makes this process really, really quick and simple. So pretty pain-free. It's a document management, or it's a document import tool, and it's designed to transfer large numbers of documents at the same time with their metadata from any other platforms, including SharePoint. So that's really pain-free. It's very automated. So it not only saves you weeks, but it can save you months with that process. And we've successfully migrated many large organizations, international organizations that have thousands of documents using that system. So pretty easy to move across. Next slide. Thanks a million, Ange. Just to mention, at MEG, we have a unique document management maturity framework, and this helps organizations to assess and improve their document management practices. So the system helps our user teams to evolve through this 3-step progression. So on the left there, people that are using the system might have a very basic or rudimentary system initially for storage, but then they can move all the way through to enabling full governance, optimized workflows and mobile access. And then you find that the teams with very strong maturity foundations, they can unlock a lot of really valuable insights from across the full quality management system using AI tools within MEG, such as our Ask MEG functionality. And thanks, Ange. And just lastly, to mention AI, because it's everywhere at the moment. We're hearing about AI functionality. We have AI capabilities already, and it's evolving in MEG very quickly. So you'll be able to summarize long documents at the click of a button and generate insights and correlations across audit, incidents, and everything will be quicker. For example, preparing reports for your board meetings, etc. And technically, AI capabilities are, very common now. They're easy enough to push out. But the key thing is to work with a partner that is experienced and has robust foundations in place, and especially has that domain expertise within healthcare. Robust security. So if you need ISO certification, or if you need GDPR, HIPAA compliance, wherever you are, you have your regulations to comply with. So a team like MEG can effectively act as an extension of your own team in that regard. So data security is paramount for us. And also in relation to AI, for example, NHS England released guidance recently that requires that AI scribes that summarize clinical consultations would now be classified as a medical device. So it's very important that you work with a team that are on top of the regulations in relation to AI as well as healthcare. So that is, and as Ange mentioned, we'd be delighted to give you a deeper dive demo. If you just contact us, and we'll send out the contact information to everybody who is registered today. So that's just a brief overview of document management within MEG. And so now I'd just love to introduce, well, she's been introduced, but Clare Harney. Clare, thanks a million for joining us today. You're an award-winning CIO and quality management guru, as Ange has mentioned. But can you briefly introduce yourself, Clare, and specifically, I guess, your quality management experience in the healthcare context?
Sure, and thanks for having me. So I've worked in healthcare and information governance in particular for over 25 years now, across both public and private sectors. And my experience includes implementing QMSs for standards like ISO 9001, ISO 13485, the medical device regulations, data legislation and standards, and of course our health regulator here, the HIQA standards that we all must follow. I work in an education and advisory capacity with healthcare providers, with health tech providers and innovators on their regulatory compliance and governance as well.
And so, Clare, what role does the quality management system play, in your opinion, in the delivery of safe, effective and compliant healthcare services?
Yeah, so what the QMS ultimately does is provide that structured way to ensure care is delivered consistently, safely and in line with legal and regulatory requirements. It embeds quality into your day-to-day operations, not just as a compliance task, and that's really important. It must become a cultural value.
So you've had all these really extraordinary roles in quality management, and through those roles, Clare, has your perspective on document management evolved? And if so, how has that changed?
It sure has. I mean, early on, it was a very, very onerous and difficult admin task. But over time, I've come to see document control truly as the backbone of a reliable quality management system. If your policies, your standard operating procedures and your records are not well managed, you can't ensure that consistency or safety or that readiness for inspections. And you want to be ready for inspections and not afraid of them. It's really challenging to operate large, complex environments or even small healthcare facilities without that backbone in place. So
you mentioned the backbone of quality management there. Why is document management the backbone of a quality management system?
Really, it's because it touches every part of the system, from training, clinical procedures, to procurement, to audit trails. And without accurate, accessible documents and associated records, no process can be reliably followed or improved, particularly across larger, complex environments such as hospitals.
So even though document management is the backbone of a quality management system, sometimes we mentioned that people can be using certain, you might have audit or risk in one system, and then they'll be using a different system for document management. Like, is that an issue? Why is that an issue?
Yeah, it is, because all aspects of quality are linked in especially in healthcare, and engagement with a single source of truth across quality functions such as audit, documents, incident management, risk management. This ensures that visibility across the organisation, and that's what you need to be ready for things like audits. And in fact, at audit, it's really difficult to properly demonstrate compliance when quality is managed across disparate systems, or indeed some places are still on paper.
So, well, that makes total sense. And then, so in your role, you're likely to come across real pockets of excellence in practice in relation to document management. You might come across some kind of substandard or poor document management control as well. And what are the risks to that, or how does that manifest?
Yeah, I mean, that's usually when they ask for my help, is when things are not working very well. But what it can result in is that inconsistent care, failed audits, duplicated or outdated forms, 27 different versions of a document flying about the place, miscommunication between departments, which can lead to a breakdown then in relationships across departments, and even patient harm due to the use of outdated procedures, These are all negative impacts that can increase risk, and it's unnecessary, and it can lead to increased near miss and adverse events then. Besides the obvious potential for harm then, the negative impact on efficiency then increases the burden on services that are already really under significant pressure. But when staff follow up-to-date standardised protocols, care is safer and more predictable. Document errors are often invisible risks until something actually goes wrong, and we want to avoid that.
Makes total sense. And then, so from a regulatory perspective, how important is your accurate version control? Like, is that necessary for regulatory compliance, such as JCI or HICWA?
Yeah, and having been an inspector for ISO quality standards, really what regulators, what they want to see is that your documents are current, that they're controlled, that they're accessible to those who should be able to access them, and that they reflect actual practice. They're not just pieces of paper that say how we do things. You can demonstrate that that's how it's done. An effective document management system then ensures that version control. It ensures proper approvals are in place for your important documents, and it gives that visibility during audit of all of that working well together. It ensures your data integrity, access control, and auditability. These are all critical under regulations and standards across the globe, really. Clear records then in support of your documents also support that defensibility in the case of inspections or breaches.
Okay, so absolutely critical. And so in terms of document management challenges in healthcare settings, what do you see is most common?
Well, fragmentation across departments is one of the biggest ones, and that leads to that breakdown in communications and kind of siloed thinking and siloed ways of operating. And you've got then perhaps over-reliance on paper or uncontrolled shared drives. And I've seen a lot of that. People saving things locally on their desktop, and then it's 2 years out of date. Lack of version control is a big problem, and it's something that's almost impossible to manage manually. And then resistance to change, that perception maybe that, putting a good document management system in as part of your wider QMS is a difficult change, when in fact it's not. It makes things easier.
And then, so some healthcare organizations are still relying on paper, as we know, or fragmented digital tools. Why do you think that is? Sometimes
it's due to legacy systems being in place. This is what we've always used. We're going to keep using it, even though, if you step back, you might realize actually we could make a real difference if we use something more modern, more user-friendly. Budget limitations are sometimes a perceived reason, I guess, but there is a big cost associated with not using a good QMS system. And then there can be uncertainty around digital transformation in itself. There can also be a fear of overcomplicating workflows, or that standardizing won't actually work. And it's a little bit of an education piece around that that's important, I think.
Sure. And then, so how can a digital document management system improve your quality management system, the maturity of your QMS and audit readiness?
Yeah, I mean, we all want to be audit ready. We don't want to panic when auditors arrive at the door. It gives you that single source of truth. So it ensures your controlled workflows are there. You can see it on your screen. You have a dashboard view. It logs every action for you and supports that quick evidence retrieval during audits. It's giving you that peace of mind that you already know that when the auditor comes in, you are ready. You know where your weak points are. You know what needs to be addressed.
So I'm attending the webinar today, and I am thinking about introducing a digital document management solution. So what should I be looking for in terms of features or functions?
So you want good version control, and that should be automated as well as your workflows. So as little manual input, because as people, we tend to mess these things up, whereas a good solution will do it very well for you. You need role-based access permissions so that the right people have access to edit and change documents, and also the right people have access to read and say that they will comply with the document. You need good audit trail capability. It should be linked to training and not just training in your QMS, wider training that's required by different levels and departments of staff. And then integration seamlessly as much as possible, perhaps one altogether solution really, with modules such as your corrective actions and preventative actions and actual audit tools when you're auditing your own organization. And then the big thing is user friendliness and accessibility. Anyone who needs to access a document are already busy delivering healthcare or doing their job. What they need to be able to do is access up-to-date policies and procedures very, very easily. And really, I mean, we'll speak to it in a little while, but that's where AI can come in to streamline those things for people. Health staff are busy. Documents have to be easy to find. I guess that's ultimately it. They need access in real time, and it's got to be the right document every time.
That actually is a great segue just onto our demo. So we might just move into that demo and get Dan to pop on. Does that sound okay, Leonora and Claire?
Sure.
We just pause there and we'll just based on that, that's a great spot to just have a look and see. Dan's going to give us our demo. So I'm just going to hand over to Dan.
So here you can see the total number of documents, how many are live and how many are pending approval. As I scroll down, you see different graphics like pending approval by approver, category of documents, documents by status, and pending approval by owner. So this offers a comprehensive overview of your documents activity. At the top of the screen, you can see MEG docs, which will take you into the module itself. And what you can see here is what an owner or an approver of a document might see. So on the left-hand side, you've got the management area of the module. And on the right-hand side, you can edit properties of certain documents. Above this, we have library view, which looks something like this. So for a user who needs to simply read the document or attest the document, they will see something like this. And this will allow you or your staff to focus on reading the document without any distraction. You can see here, we have different icons next to each document just to show that we've attested it or whether it requires attestation. If I was to click into that, it will take you to a view that looks like this. So here you can simply read the document, and at the top, you can tick it to confirm you've read and understood the document. So flowing back to the main screen, I'm just going to explain the management area. So here we've got new. So once I click that, you can see upload documents, create documents, create folders, and we can assign different permission rules and publication rules. So upload documents, if you wanted to upload an individual document, it will take you into a page that looks like this. So you can upload it to a certain folder. You can assign a publication rule after upload. You can assign different levels to a document, institution or group, the category as well, and then upload at the bottom. On the right-hand side, you can set review intervals, the last review date, and then who the owner and document controller are. And here at the bottom, you can see published documents. So if there is a publication rule where you wanted it to automatically publish once all the steps have been completed, you can just tick that box there. So MEG can also bulk upload documents just to help accommodate an easy transition from another system. So flowing back to the main screen, so you can see underneath upload documents, we've got create document as well. And here we can upload your templates or provide some of our own to allow you to create a document on MEG. Folder creation below this. So as you can see, as I scroll down, I've created different folders. And this will help organize your documents. Below this, we've got create permission rules. So the folders that I've created, I can assign a permission rule to this. And here you can decide on who can access the documents within that folder. Below this one, we have create publication rule. And as you can see, it will look something like this. So this can be applied at folder level, but can also be institution, or you can apply the rules to individual documents. I've started creating one here, so I've named the publication rule. I've assigned it to the folder policies and procedures, and the publication rule as well. So the document is to publish immediately after all the steps are followed. So the publication steps here, you can then build them out. So you can see add step. And our publication rules can handle as many reviewer or approval steps as your process needs. So if I flow back to the main page of the module, so on the right-hand side now, you can see action. So here we've got edit properties of the document. So not all users will have this ability. This is restricted to the owner of the document. So if we click on that now, it will take you into a screen that looks like this. So you can see the document on full view here. And here you can just edit different properties. So as I scroll down, you can change the name of the document. You can assign a document code, description, and then tagging here. So what I've done in this document, I've added different tags like audit, implementation, important, support. And tagging will aid filtering of documents to help you locate a certain document. You can then change it from folder. You can change the category. And below, you can just change your review intervals as well, if you wish. If you wanted to add in some additional approval steps, you can do so here. You can assign it to different reviewers. As I scroll down, you can see forms and documents as well. So documents, you can link documents together if are similar in content. And then forms, documents can also integrate with other modules. So a user can link a document to an audit, an incident form, or any other data collection page. So as I scroll back to the top, you can see attestation. That's the next tab. So here you can check how your document is performing by looking at the statistics behind the attestation checkbox, which I showed you earlier. So here you can see a breakdown of the different teams and who's attested it. So here you can see Angela has attested it and who needs to attest the document as well. This can also be downloaded and circulated as required. Next to this tab, we have versions. So we have version control built into the system. So here you can see that the latest version is published and any archived versions are still here for you to access. As I scroll back to the main page now, you can see here different options now. So we've got bookmarking. So bookmarking capability. So next to each of the documents, you can just click those and it will bookmark. And on the left-hand side, you can see the bookmarked areas. So any documents that you consider important, you don't have to search for them. You can just bookmark them and they'll be saved in this folder here. And lastly, at the top of the screen, you can see filtering functionality. And this will just help you look for documents. So here you can sort of filter by date, by owner, approver, folder, and category. We also have search capability. So if I click on that now, you can see here that you can search by title, the tags, which you can see underneath each of the documents here. So Appendix 2, you can see important audit implementation support. So you can just type in audit and it will find that document for you. But you can also see that it can search the content of the document as well. So if there is a keyword you're looking for within the document, it will pull that document for you. So that concludes my demonstration. Thank you for your time today, and I hope you found it useful.
That's great. Obviously, Dan's in Barbados at the moment, so that's one he prepared for us before he left. Yeah, so maybe we'll just open up to Q&A for the last couple of minutes. If people have anything they'd like to pop into the Q&A section or maybe just into the chat, something like that. Just while we're waiting for those, I'll just share our contact details there just in case you do want to get in touch afterwards. Any takers? What have we got there? There's our contact details. We usually get questions from customers about implementation time, that type of thing. So we've got a hand up there, or is it someone entering?
Someone entering, I think, Ange.
Someone entering. Yeah, we'd normally get questions kind of around implementation time, that type of thing. So it's a bit of a how long's a piece of string. But if the organisation is pretty ready, like if they've got all of their documents kind of collated in one place and they just need to be kind of transferred across to MEG, could be as short a time as 4 to 6 weeks, that type of thing. Would also include training. Obviously, we help you implement and set up your accounts and get those users in their different kind of mission levels up to speed so they can use MEG. I'm going to come back now. Just gone a few minutes over. I've got a question in here. What have we got here? Can the demo link be sent out or recording? We'll do both of those things. So we'll contact people after the end of the session with the video of the demo and a link with the slides as well. And then Sinead, do you have something you'd like to add there? I'm just going to unmute you if you'd like to ask a question.
Oh, yes, sorry. Thank you. This is Sinead. I just couldn't unmute myself. I'm Sinead Carroll. I work in quality and patient safety in St. John's Hospital in Limerick. I was just inquiring about the rollout. Does that include staff education to use the system, or is it more focused on the transfer of the documents?
Both of those things. So yeah, it would include both of those things as part of our licensing and also ongoing support. So we would work with you and the team, set up your account, set up all your user permissions, get everything working nicely, and then the user training. So it might be a couple of different sessions for a couple of different levels of people, maybe like a super admin person who can make changes and set approval rules, that type of thing, right down maybe to someone who is just viewing and attesting to documentation. So yeah, make sure everyone's up and running.
That's great, thank you. And sorry, I just have one other question. Just when you, Dan went through in the video about it can be acknowledged that the policy has been read. Is that kept in a bank where you can look at who's accessed it, how long they've been viewing the document? You know, is it just they clicked it open and they clicked it closed again? Or, you know, is it how much of a depth does that go into? Is it just a list of usernames if they use generic logins?
We can definitely give you, so everyone would have their own kind of unique username and password, their credentials, so you could kind of track that. So we could definitely give you a list of who has clicked the attestation. I'd have to come back to you on those other kind of points around time spent on the document. I think at the moment we don't have that kind of capability, but it's a good idea. I like
Thank
it.
you. No, just something.
Product development. Yeah, that's true. Yeah, that's absolutely a valid. Just to make sure people are really kind of digesting the information. Yeah, I'll come back to you, Sinead, about that.
Perfect. Thank you so much for that. Thanks, Angela.
Thanks.
And Sinead, definitely, I was just going to add the capability is definitely there to do that. We have our MEG, you know, the e-guides as well, which is the, you know, the procedures used at the point of care, which is on an app. And sometimes people don't have, you know, the username and passwords to get into that. So, but you in the document management system, you have full capability for analytics. So we can set that up in the implementation, whatever the analytics requirements would be, we could make that happen.
Oh, that's great, Leonora, yeah, because we do use some aspects of MEG already and it's accessible on tablet form. But, you know, if it was to be progressed to desktop, I just wondered, you know, would it be specific users then that we could acknowledge who have read and looked at the documents?
Yeah, absolutely.
That's great. Thank you so much. Thanks.
Thanks, Sinead.
Pleasure. Anyone else for anything else, or we let you go and have your lunch? What do you think? These are hungry participants. Okay. We'll stop torturing you with our prompts for questions. Listen, thanks a million, everyone. Thanks for joining us today. And thanks so much again, Clare and Leonora. Really interesting kind of real world experience of document management and policy management. Okay, we'll blow it up.
Thank you.
Thanks, everybody.
Okay, thanks, Emil.
Thank you.
See you. Bye. Bye.